Hello, my name is Sam Sia. I'm a professor of biomedical engineering at Columbia University. I'm really delighted to be presenting this Tokyo Metropolitan University global lecture on miniaturized devices and artificial intelligence and how they can be used to try to achieve improved and equitable health for all. And this is really an important subject because we would need these technologies to work for us. And by us, I mean really everyone across all sectors of society. This kind of idea, looking at Japan specifically, is not new. In Japan, I think there's this idea called Society 5.0, really looking at the post-industrial revolution, the latest industrial revolution, the revolution that we're in now really involves information technology as well. What would this society look like? And there are a lot of things to think about, including urban living and many things. But health is really one of the big aspects of this. And in this vision for Society 5.0 in Japan, thinking about providing health services to everyone across society, including the elderly, and which of course is a growing demographic. Now, how would you do that? You can bring the elderly back to hospitals and to these settings for checkups, for care, but it would be better if we can actually provide the services to them where they live at home. And in order to do that, you would want to have devices that can perform a lot of services that you would normally do back in a hospital. Now you can do that in a home setting. And then you would need the connectivity to actually get that data and communication back and forth. Maybe with telemedicine, the physician or another provider can provide those services. All of that while the elderly or the patient is comfortably sitting at home. And that way you can catch a disease early and you can get continuous care. So can we actually achieve this vision? Now, in order to do that, you will need some technologies that we don't have today. And this is what I want to talk about here in the next hour or so. Starting with some of the technologies in my own lab here in New York at Columbia, but really a lot of groups in the world are working on this, including a lot of great research groups in Japan. We're inspired by what has happened, of course, in the electronics world, and you know this in Japan being a pioneer of this, where there were very promising devices in electrical engineering with transistors, but they were really large to begin with, performing these logic operations. And it was not until they were miniaturized into small transistors and then really arranged together into more complicated components into a little small chip that we had personal computing, mobile computing, which enabled so many different types of devices that we see here today that are all smart devices, connected devices, not limited to computers or cell phones, but really just everything. What about fluidics instead of electronics? And by fluidics, I mean manipulating small volumes of fluids. You would need to do this for diagnostic testing. This is not moving electrons around as in electronics, but moving fluids around, mixing reagents so that you can perform a diagnostic test. Maybe you would need to administer a drug. That also involves fluidics. A volume of a drug, a fluid that contains a drug or a vaccine, some of that has to be then put back into the body. And this is fluidics. And when you're working with small volumes, that's called microfluidics. So can we shrink the movement and the manipulation of these volumes of fluids, small volumes of fluids, down into a little chip, the way we have done that with electronics? Can we do the same thing with fluidics? And if we can we then also have a similar revolution in terms of the impact on the world? In this particular case, maybe an impact on health in particular, because whether it's diagnostics or therapeutics, it typically involves some sort of fluidics. So that would be the dream. And I would like to break down the presentation here in terms of three areas. The number one area is something called the point of care diagnostics, where you would take a specimen, whether it's a drop of blood or a swab, and put it into a chip. The chip will perform the functions that you would normally perform in a lab. So sometimes this is called lab on a chip, but you would perform a diagnostic sort of function. So I'm going to start off with that and then go into more and more futuristic things, wearable devices, and then maybe combining that with cloud, data, AI, and then combining that with therapeutics also. So let's start off with the first topic here, point of care diagnostics. Many years ago, my lab really built on a set of technologies that I co-invented with a couple of other scientists and collaborators, most notably Vincent Linder. And this was back at Harvard before I started at Columbia, but we ended up starting a company called Claros Diagnostics, which was acquired by Opco Diagnostics. And Opco Diagnostics ended up developing a blood test, which could be done in a doctor's office for prostate-specific antigen. This is an indicator, early indicator for prostate cancer. It's the second leading cause of cancer deaths among U.S. men. So speaking of elderly, prostate cancer is, of course, a big killer, one of the big ones for cancer for the elderly and even for middle-aged men. PSA is an early measurement of that, and what we wanted to do was to have a machine which can take a drop of blood and give you that PSA test so that you don't have to draw blood from your arm and send it back to a lab. Why would this be helpful? Because then you can get this result with a finger prick in 15 minutes in a doctor's office and then have a conversation with that doctor right away instead of waiting for days and maybe just losing track of where things are in terms of the testing. You can really streamline that discussion right there on the spot with your doctor. And so this was a test that ended up being developed and FDA approved in the United States. And just to show some of the data here, on the y-axis is the machine, and on the x-axis are three different types of lab-based tests. These are the latest generation lab tests, and you can see a very good correlation with the machine that we have. This is a quantitative correlation, so we can give you a quantitative number, not just your high or your low. We can give you a PSA number. So this kind of technology with miniaturizing the fluidics is starting to really take place and to really measure, in this case, protein levels from your blood with just a finger prick of blood from whole blood from your finger instead of drawing it from a venipuncture from your arm. And it can do it in 15 minutes in a machine instead of waiting for this to be done back in a big lab instrument. So I won't go through the details of how this works, but this is starting to become possible. So this kind of work is happening. There's not that many many different examples of point of care blood tests that can be done in a lab, but they are starting to happen. Now, my lab has also been trying to develop this technology for even places like Africa, sub-Saharan Africa. And so we started adapting this type of technology in a way that's lower cost and to be used for things like infectious disease, HIV, sexually transmitted infections in sub-Saharan Africa? Can we offer tests that would normally be done in a lab, but do it in a cheap, low-cost microfluidic test in even a place like Africa? So we started with HIV, and we started doing that work there, and this is an example of that study. We made another version that can work with a smartphone, and this is a number of years ago now, 8 years ago, where this is a version that works with a smartphone. The way this would work is all that complicated machine that costs tens and hundreds of thousands of dollars, we've distilled it, miniaturized it into a little machine which we call the dongle. This costs about $30 US, so much lower cost and much smaller, which can perform a full-scale lab test, what we're calling here an ELISA test. ELISA is a standard kind of lab test. We can run that in this dongle, and in this particular case, this is a $30 hardware, but it's actually reusable. We would then have this low-cost plastic credit card, which is disposable every time. You have to, it's a one-time use. And that costs probably less than $5 for every run. And you would insert that into this dongle. That's what you see here on the left. You would insert that into that dongle once it has the blood on it. And you would then read the result on your phone. So that is also something that is starting to be developed. And we tested this in Rwanda, looking at HIV and also different sexually transmitted infections as well, which you can look at together. So this is also a survey that we administered on the users. Would they actually like this kind of test? And even in Africa, we asked them in their local language, and they did like it actually, because it was fast and less painful than drawing blood from their arm, and so that was also very well received, even in a place like sub-Saharan Africa in Rwanda. In this case, this is a number of years ago again. And so can we offer HIV as well as syphilis tests together? And there's good user acceptance of this kind of technology. Equitable health. That is one theme that I promised we would try to tackle. It has to be low cost enough in order to make a really significant difference. And you can do this kind of economic analysis. So again, we did this, back a number of years ago, and one way you can do that is to measure the public health impact you would make compared to the cost of administering that impact. And so in this analysis, we included the cost of both the diagnostic device, which is what we're doing, as well as the cost of the therapy that would be needed to treat syphilis. And for that combined cost, you might be saving an entire life, actually, from birth, because congenital syphilis, if it's not diagnosed, can result in a stillbirth. So compared to that cost, and compared to each year of life that you could potentially have an impact on, what would be the right ratio? So you can do this kind of economic analysis, and we were saying that this would be actually very cost effective. So it's still challenging to introduce a test like this in developing countries because it does cost more money. then even if it's just a few dollars a test, that is more than the $1 or $2 that are currently the cost of HIV rapid tests. So we will have to work through that still, but you can still present the argument here for why it could be impactful. So it's hard to introduce a technology that costs more money in developing countries and in a lot of countries, really. But this is something you really want to think about, not to just make a technology that's really inexpensive and really has no hope in the future for people to use them. Well, COVID is something that has happened in the last few years, where testing has really become something on the forefront of everyone's minds. And one thing we're seeing now is there's more and more home tests that people are using, which is good. You don't have to stand in line and wait for a test. You can maybe do these tests at home and you can get the results quickly. But they're typically antigen tests. They're not as sensitive as PCR tests. So what my lab has also been working on is trying to offer PCR tests that can be done outside of a lab. And these machines can run PCR. They can give you a result in about 25 minutes or maybe less. And it's as accurate as the lab-based PCR. Maybe even eventually you can do this at home. And so that's really our focus here, is we want to offer simple point-of-care, affordable PCR tests. And I won't go through how this works, but we're offering this in a format where instead of taking traditional heat blocks, we are heating up the solution with light. PCR requires the temperature of the solution to go up and down many times. So you need a way to heat the solution. Now, with light, the machinery to do that is actually easier, because you just shine a light instead of having heat blocks that take time to heat up the solution. When you heat up something in your oven, it takes time. That's convection. Whereas like a microwave, you're shining light directly into whatever it is that you want to heat, and that's actually faster. And so it's the same idea that we want to actually do the heating and cooling faster, and also with simpler machinery. And so we were able to show that you can get this to work for COVID, even with both saliva and with swabs in the nose, and you can do it within 25 minutes. And so this is starting to become commercialized again, and you can imagine by taking these types of tests outside of a lab, outside of hospitals, and putting them into businesses, into pharmacies, maybe even at home, then you're enabling everyone to have these accurate testing in a more private, in a more distributed way, and really catch the outbreaks earlier, instead of having a bottleneck where everything has to be sent through a lab. So this is also part of what we're doing. So point-of-care diagnostics, in terms of taking specimens and doing a test on them in a little microfluidic chip, that is work that is continuing to be done. It requires this technology of microfluidics, because you have to be able to mix chemicals together, do detection with a little volume of blood or swab. That is microfluidics. And so it's a technology that really a lot of us are really excited about. And there's a lot of great work in Tokyo and in Japan on microfluidics. And so it's it will be more and more commercialized by companies, and this is how we're going to take not just the simple home tests that you're familiar with now, like the COVID antigen test, but more complicated tests that you can offer them more and more to people at home. That's point of care diagnostics. But what that requires you to do is to take a specimen, whether it's a drop of blood or a swab, and to put it into a little chip. That's great, but it's still sort of a testing procedure that you would have to do. The next step might be something that you would actually just wear. You can just wear, and you don't have to think about it. It will just monitor whatever is going on in your body, and just send that result somewhere. So this is happening with a number of groups around the world, and most notably, there are devices that are starting to be developed where they can be put on your skin and maybe measure different chemicals in your sweat, for example. You're sweating, it can sample your sweat, it can measure those certain chemicals. But our approach here is to look at the level of these markers, not in sweat, but actually in your body. And there is something a fluid right under your skin. It's called interstitial fluid. This is how continuous glucose monitors work for diabetic patients. They look at the glucose levels in your interstitial fluid. It tends to fluctuate less than the levels of these markers in sweat. It tends to be a little bit more reliable. And so, for example, we can think about calcium, which is one type of chemical we're thinking about that we're working on. But there's other types of chemicals as well. In this initial concept, what we have been working on are these microneedles or microfilaments made up of something called hydrogels, which are these gels that are biocompatible, that are similar to what we have in the soft tissues in our body. So they're biocompatible and so forth. But we make them penetrate the outside of your skin, and that way it's in contact with the interstitial fluid that's right under the epidermis in your skin, and they will be in contact with the chemicals, and we want to be able to sense those chemicals. So the way we do this is we also use microfabrication with hydrogels. So can we make little needles, and they are long enough so that they would actually penetrate through your skin. They have to be sharp enough as well, but they're pretty small actually. So I know it looks kind of scary, just like the needle that goes into your vein. But these are even smaller, and they actually don't hurt as much. So in fact, we can put them on a human subject, and the human subject would report that it's kind of like rubbing some Velcro on your skin. It's a little bit more painful than that, but it's less painful than having a normal needle that goes to your vein. And then after it penetrates your skin and you take them off, then actually you don't really get much of a reaction. Half an hour after you remove the microneedle patch. So this is something that we're working on, looking at something like calcium condition here. So for example, in this particular disease, hypoparathyroidism, you really need to be on the lookout for abnormal calcium levels, and in response, you would take calcium supplements. It's very hard to really gauge or really think about how much calcium to take. You're sort of really guessing. And if it's too high or too low, you're going to have side effects. So what would be nice is if you have a way of actually sensing what the calcium levels are, so you would know how much to take in response. And this happens in your body for a lot of different things. You would sense the level of something, and your body would then adjust depending on what it's sensing. But that's not how we're doing things right now with a lot of drugs. We're just asking you to take them, right? We don't really know exactly what is going on in your body on a daily basis. So we would like that to be done pretty continuously, and that's what this technology would allow. So we're working on this right now. Okay, let me get to future connections here as well. So in terms of the fluidics, how would we, that's great for either, hopefully for point of care diagnostics, or if you could have some version of this where it's on your skin. But how will we get the data? Is someone going to read the data off of somewhere? Or is this going to go into the cloud? Are the data going to be analyzed by some sort of artificial intelligence? And then what is this all going to mean in terms of therapeutics? Because sensing, diagnostics, that's important, but that really tells you what the state of the body is. But, what does that mean? Are you going to change that with a drug therapy somehow? So that link between sensing to therapeutics, that link could also potentially be done with artificial intelligence. So how will all of this work? So the first part of this is, how do we get the data from your device to some sort of storage, maybe on the cloud? So I will start off this section by going back to some tests that we're all using right now. So this one, for example, back to COVID, because we're all familiar with it. This is an example of a COVID test you would be doing in Japan. And well, this is actually a problem right now, is that, if you remember at the beginning of the pandemic, you would go somewhere and get a test done, and they would actually even track the positive results, and they would contact you. As these tests are being pushed more and more at home, now, again, they're not as sensitive as the lab tests, but they're pretty good. So it's being used is good because people can do them more often. They get their results faster. That's good. But the public health authorities or the government, they don't have access to your test results anymore. Okay, if you went to a clinic and got your sample sent back to a lab, we can, monitor, the government and whoever else can monitor where the outbreaks can be. They can monitor the prevalence. But if everyone is doing these tests at home, then a lot of times, most of the times, almost all of the time right now, these data are actually lost. So can we have an easy process where this data can be uploaded to the cloud? Now, there's a lot of issues here. It's a complicated topic because even if you could do that, a lot of people might not want to do that because they have concerns about privacy and so forth. But there are ways to get around that as well that could address that. So let's just talk about the technology. So are you going to go into your phone and enter in the data manually? Another way to do it is to take a picture of your result, and that automatically would send the result to a cloud. That sounds easier. The problem, or one problem with that, is there are so many different types of COVID tests out there. So if you design a reading algorithm that would read one type of test kit, it's kind of like this game we have called whack-a-mole, right? Like a mole comes up, you whack it. It's a kid's game, and another one comes up. There's so many different test kits, and they all have a different kind of format in terms of their lines. And so what we showed here and this is with Shifu Chang. I forgot to put him on this slide. He's the Dean of Engineering at the Columbia University, but he's also an expert in image recognition and machine learning. And really his group developed this technique working with our group where it can use something called few-shot learning. So by training on a base model, you can take as few as 20 images. You don't need a lot more than 20 images of a new type of test kit format in order for a machine learning model to learn to recognize the images in the new COVID test kit. So you can have as many COVID test kits as you want now, and you don't need to train the model every single time. You just have to adapt it, fine-tune it on maybe 10 or 20 new images, which is not that bad, right? Imagine you have to retrain the model every single time on a new test kit. So it's a neat sort of tool that Professor Chang has developed. So all of this is to really help the end user rapidly send the results back to a lab. This will become more and more important, again, as you can imagine, when more and more testing is done at home. It could be an elderly person, it could be all sorts of people, right? You're doing these tests, but how are you capturing the results back into some sort of data system? Other types of data as well. I have this project, my lab, that is led by Dr. Ann-Katrine Ullman, who's an infectious disease expert, also working with Kartik Chandran, who is an expert on water, all things water. And here we're looking at wastewater. So can we monitor pathogens like COVID in wastewater? So that's another kind of data that might be coming in terms of more proactive monitoring. And that can, by looking at wastewater, you don't have to change anyone's behavior. It's kind of like a wearable device, right? Like you don't have to think about it. You don't have to do a test, and you can still do some sort of monitoring. Of course, this is going to be done at a building level, so it's not specific to individuals. But we are looking at this kind of technology. It's a different kind of data, health data, from a different kind of source that will be coming in as well. So all of this data have to be coming into some sort of data system or repository. And the company that I have spun off and am working with, Rover Diagnostics, they are also developing this cloud-based system that can go end to end. And so it has an interface for the user, but it also has a back-end sort of laboratory information management system for managing all of this information, including reporting the results to the health authorities. And so both the front end and the back end, an end-to-end system, and Rover is developing something like that. So, so these are attempts to try to capture these data that are being collected in all sorts of settings. You might have to tag them with a geolocation coordinate as well, so is a timestamp data, is a location stamp data coming from all sorts of different sources, who performed it, and so it's a more complicated set of metadata, and all of this has to be analyzed a little more methodically than before. And so just getting that data protocol standardization, that's becoming more and more important. The other link I want to make a connection to here, in addition to data, when it comes to these sorts of devices, is therapeutics. And it's not just about sensing and data. It's all about therapeutics. And here, the microfluidics, miniaturized devices also has a really important role. And so instead of doing injections of drugs or taking them manually, can you build a little device that can deliver the drugs as well? So we're almost thinking like a robot, not quite there yet, but a tiny robot. And so in this case, we're making this robot out of the same material that I talked about before, called a hydrogel. And these are materials that have a very high liquid content to it. That's why it's called a hydrogel. And they are similar to, again, the soft tissues in our body. And they're also very biocompatible. What we try to show here is you can build these machines made up of hydrogels. So we take this design with mechanical watches. I know you know, watches, they're very popular, for a lot of people. And Japan also has a huge industry in watches, obviously. But, can you make a very complicated design that you think normally has to be made with metals, right? Because they're very small, it's very intricate. These gears turn each other. And so just for fun, we wanted to see if we can build this kind of device with hydrogels. And so this is an example of something we did is layer by layer, multiple layers. We stacked them on top of each other with hydrogels. Can we spin little gears? And so I'll show you a movie here where we have done that. So with an external magnet, you can spin the small gear, and then that will turn the spin the small gear, and that will turn the large gear. And these are made up of these soft hydrogels. So the hydrogels are soft, but they are still hard enough so that they can respond to these intricate gear movements. And the yellow part could be a drug. Okay, that could be a drug in a reservoir where if you spin it to the right location, that drug can diffuse out a window. So you can imagine that. And that is actually what we did. In this demonstration, we did it for a cancer model in mouse. This is a bone cancer. Did this with a collaborator, Francis Lee. And this is a case where you would want to deliver chemotherapy to that bone cancer in order to control its growth, depending on how much that cancer is growing. Now, you're delivering this very, very toxic chemotherapy, which will actually impact a lot of other organs in your body if you're delivering too much, including your heart. And so you don't want to deliver more than you need to. And so here we can monitor how the cancer is developing, and that's what you see on the upper right with imaging. And depending on that, you can deliver the drugs as you wish using this method. And over 3 weeks, so we implanted this in a mouse. Over 3 weeks, you can spin a gear, every day and release this chemotherapy. And we were able to control the drug, the cancer growth better than the chemotherapy if you just administer it in general, systemically, without any sort of control. At 10% of the maximum lethal dose that you would normally require. So that's because we're releasing it locally instead, and we're doing it once a day over time instead of just adding this really maximum, lethal dose. So or near lethal dose. And we also have fewer side effects on the heart cells as well. And so you can now start thinking about connecting your any sort of sensing information to a small device that could release drugs that you can control. Now, the way we did this is using magnetics. So we take an external magnet and we spin the gear that is in your implanted in the mouse. But another way to release a drug that is in your body is not magnetic, but using ultrasound. And so this is something that we have been working on, in this case with Parag Chitnis at George Mason University, where we implant a device, but then we use external ultrasound to trigger the release of drug in that device, okay? And so we can put this device that has the drug into the mouth, and it won't really be released. It will sit there. When you want, you can then use ultrasound. Ultrasound, you usually think about using it for imaging, but here we can use it to image to find where our device is, but then we can actually use focused ultrasound to then trigger the release of drug within that device. So we're using ultrasound actually as a triggering mechanism, and the way this works is it increases the local temperature of that gel, and that gel is thermally responsive. So when the temperature goes up a little bit, it'll actually release the drug. So that's how this technique worked. And so it's another example now of how to use small devices to release drugs. This time it's controlled by ultrasound instead of by magnetism. So you can use small devices to sense. You can use small devices to release. Is there a way to connect them all together? And so both the sensing, use a small device to sense, small device to release. And this is one project that we're working on with Ken Shepard and a lot of other professors as well. And this is done through a large project that's funded by the federal government for wound healing. And the idea here is, can we heal a wound 50%, half the time compared to a normal wound dressing? So the way this works is we have small sensors and small actuators that would deliver drugs. I won't go into all the details, but Ken Shepard in Columbia Electrical Engineering has developed these full integrated circuits that are less than 500 microns. Okay, it's really amazing. They don't have a battery either because they're actually powered by ultrasound. So when you have focused ultrasound on them, that would turn on these so-called motes, then they will also sense things like pH, temperature, or levels of different molecules in that particular location in your wound. And then it would then send back some sound signal because it has piezoelectric elements, transducers right on the mote, and then that can then be picked up by our sensor. So we can actually communicate with these very small sensors that can be distributed throughout your wound and tell what the different temperatures or pH or levels of molecules in different parts of your wound. So that's the way to sense what is going on here, and the communication is done with ultrasound. Using some of the technologies I showed you before, then we can tell using ultrasound some of these implanted actuators to deliver drugs. So depending on what's going on in the wound, we can say, oh, it looks like you're in this phase of wound healing. Wound healing has, different phases. And we can say, oh, you're in this part of wound healing. We will now release this particular drug. So it's personalized wound healing. It's individualized to that particular wound. It's not one size fits all. We have sensors and actuators that will respond and then treat your wound depending on exactly what is going on in that wound. So that is really, kind of a crazy vision, but that's a way to use small devices and actuators, sensors and actuators to, in this case, accelerate wound healing. And all of that is connected by a machine learning algorithm that will interpret all the sensing data, and then it will instruct the drug delivery. So that is done through the machine learning model. And at least for the drug release part, because that's what my lab does, we published a paper on how we can make these little drug delivery vehicles in order to be responsive to ultrasound, and then for them to then release drugs. So we're also now thinking of maybe adding some element of movement. So we can add an element of movement to these sensors and actuators. And we can think about building little robots that can go around and sense what's going on. It can then perform a certain function. All of that is controlled by, say, ultrasound. And maybe they can go around and spot cancer cells and actually kill them. And this would be really, we're not there yet, but this would be a whole different way of doing medicine using miniaturized devices. It's not about taking small molecules or taking biological molecules. This is how medicine works now, right? You flood your body with these types of drugs, and sometimes they also have side effects. You're now thinking about sensing and treating medicine with a device-based approach. And these devices can be very specific. They don't have to go around and just cause damage to everything. They can be very specific. But there's a lot of work that still has to be done to have a future where it's a device-based sort of sensing and drug delivery, where the devices are so small, they're biocompatible, they can be controlled, they don't cause side effects, but you can program them, right? Like you would program a smartphone into these little devices. It's a whole new way of thinking about medicine. And of course, all of this stuff can be controlled, monitored in real time with communication. And so that is a little bit of thinking about the future. So a number of years ago, even just with the first topic, point of care diagnostics, we sort of made the statement that you would need some sort of fluidics in order to do those types of point of care tests, right? You need fluidics, mixing chemicals with your blood specimens, you need fluidics, but you also need this interface, user interface that is, so well developed with consumer electronics. Combine the two, that would be the future for point of care diagnostics, and we wrote a paper on this kind of thinking. Today, I really want to present maybe a slightly updated vision, not really even just for point of care diagnostics, but it could include wearables. It could include implantable devices towards, if you want, would like to call that Society 5.0 in Japan for health, but really for the future of medicine in general. And this is one where we're combining fluidics, but we're also combining cloud, right, the connectivity of that data, and combining artificial intelligence. And that's really the subject, again, of today's talk. Can we combine all of this, which can also include therapeutics as well as sensing in these devices? But we need data connectivity, we need artificial intelligence, and with the devices, all of these things together, then is that a way to provide telemedicine monitoring services? Because then we have these devices. They can be tests you can do at home, like point of care devices. They can be wearable devices that will stay on you, that will constantly communicate data. They can be implantable devices that can also collect data, but that can also release drugs. You need small devices in order for this to happen that can also communicate the data. So I would offer this as a vision, not for the very, very near future, but maybe in the years to come. And this is going to be a way then we can have medicine done more and more at home instead of requiring everyone to come to a hospital. Last fall, I also presented at a meeting, online meeting called Medicine in the Virtual Age, and thinking about some of these hurdles for the technologies to be adopted. It's not just about the technologies, right, to make them. There's a lot of issues that we would have to overcome in order for that to happen. But even if you can build the technologies, what are the ramifications? We're seeing that now with some of these large language models. Okay, you've built the technology, that's amazing. But we really have to be thinking about the ethical, legal, societal implications, and hopefully thinking about that while they're being translated to impact, as opposed to thinking about it afterwards. And so here are some issues. I won't go through all of them, but we should think about the end users. We need to think about the regulatory requirements in the US. This is controlled by the FDA. The data handling, there's a lot to think about there. The machine learning, the mobile apps, how will this work in global health settings, privacy. There's a lot to think about. But then now when we're thinking about even the more futuristic technologies, with more machine learning, with therapeutics, okay? What I've listed here doesn't even cover therapeutics, right? There are even more things to think about. Is now not only a sensor, it's a drug, it's a biologic, if you're delivering a biologic, it's a combination, drug, biologic, and device. This is a lot of things to think about. And data, how do you regulate that? So, in that final vision where you sort of have everything in you and it's sensing and you can control it and it could deliver drugs, even if you can build all that, there's a lot of issues to think through before that can be done really, it should be done, in society. So a lot to think about, but I really think we're going to head towards that sort of future with preventive medicine as well as just, the way medicine is done in terms of treatment as well, with miniaturized devices and so forth. And finally, just a few more slides about how all of this can be translated into the bedside, into the home setting from a lab. And you would need companies, startup companies, and then bigger companies, not only in health, but also in digital space, in data sciences, in the tech community, in hardware. You would need health tech. You would need a lot of different types of companies, big and small, to work on these technologies. And so there are a couple of initiatives that I know about in Tokyo that are really exciting. And so recently, I think there has been some meetings and some forums where you're bringing together universities and also companies in order to think about how you can achieve innovation in Tokyo, and bringing together again that ecosystem of different types of groups. You also want to have the end users as well. So it could be hospitals, it could be individual human subjects, it could be community groups as well, right? It's very important to include community groups. As we saw in COVID, we really need to work with everyone in order to, if we're going to be successful and not just introduce technologies that the public doesn't even know what they are and they might not trust. And so coming up with the right ecosystem in order to take innovation and bring it to impact is something you're doing in Tokyo. And highlighting some of the parallel work we have been doing in New York that I have been involved in New York. And this is an incubator right close to Columbia in Harlem that I started now 10 years ago with the New York City Mayor's Office. And this incubator is still going strong. And here you see a picture of that. We have many companies in that incubator where we're trying to support their work in bringing their ideas, whether it is diagnostics or drug development or devices or scientific research services, bring all of that to market. And it's really, close to a university like Columbia as well. So you see that kind of interaction with a university, but then with companies. And for them to be close to each other would allow you to build an innovation, ecosystem. And we shared some ideas of why sharing resources is a way to do this, right? Instead of everybody having their own equipment, sharing can actually promote, innovation to take place. And in West Harlem, what's really exciting to me also is we're doing this in a community where it's a very important community. It's a very rich historic community in Harlem. And the latest, initiative as well is something called the Pandemic Response Institute that is co-hosted by both Columbia and the City University of New York. And this, I think, is sort of similar to Tokyo Metropolitan University as well as a public university. And it's really, really crucial that this innovation takes place not just in a university setting, and we don't really talk to the public until much later on. It's really important to include the public. They can help with the innovation, but they can also give input into the innovation in terms of the being an end user. And in a place like Harlem, we can also involve and inspire and involve young scientists or future scientists that are from different backgrounds, right? Really show them what is possible out there. It's also a way to not only get their input, but also build trust that they see that this exciting science and engineering are being done in a transparent way. It's not a big secret how it's done. It's not supposed to be a secret. This stuff, all of these results are published. They can see it. They should be part of the process. And so I think this type of innovation is going to be really crucial in order for all of society to feel that they really are part of this process. So part of my role also at Columbia, I have an administrative role at the university, and that's being a vice provost for Columbia for something called the fourth purpose. For higher education, including Tokyo Metropolitan University, typically you have education, such as what we're doing here today. You also have research. There's great researchers at your university, so education and research. There's also a third pillar, which is called service, working, for the university, but also for your profession. But what we're also calling at Columbia is there's a fourth purpose for higher education, and that is to take our discoveries of knowledge into impact, positive impact for the real world. And in order for us to translate the scholarship into impact to meet global challenges, we would have to do this not by ourselves. We would have to do this with external partners, with government, with nonprofits, with industry, with community partners. So we really have to do this with external partners if we're to be successful. This is the fourth purpose of higher education and of universities. And we have a commitment to doing that at Columbia. And my role right now is also to help all of my colleagues at the university to achieve that mission. Final slide, I want to thank my researchers back in my lab, very, very talented group of students and researchers who developed that work that I was so happy to show you in the last hour. So a little bit about the future of maybe healthcare as I envision it, using miniaturized devices combined with artificial intelligence. And so thank you so much for spending this last hour with me.